Thank you for the opportunity to talk to you about the really exciting healthcare workforce initiative, building a workforce for a healthy California for all. I wish I could be with you in person today. And I want to thank you for the opportunity to be here and for your very innovative and critical work. HIP is unique, regional sector planning, working in collaboration with the Public Workforce Board, the Public Workforce System, with high-level employer engagement. I want to congratulate you and let you know that we look at you as a model to be replicated throughout the state. I want to talk briefly today about the Healthcare Workforce Initiative, its funding base, its plans, how we're thinking about building a true initiative, and ways that there could be opportunities for HIP. The origins of the Healthcare Workforce Initiative really lie in the governor's Jan 10 budget this year. And Dr. Mark Ghali, the Secretary of Health for the state, had commented just constantly on how not a day went by that he didn't hear from providers about the shortage of healthcare workers. Just in these next 2 years, the state is facing net growth of 127,500 jobs with over 500,000 job openings. And these are jobs that pay average wages of over $65,000 a year. These are good jobs with proven and potential career pathways. And so the goals for this $1.5 billion initiative with its 12 program components are to address workforce shortages in allied health, in nursing, in human services, to increase diversity, language, and cultural competence, and to create pathways for families sustaining jobs. I'm going to go through the specific program components briefly, and always welcome to follow up for more information. The nursing initiative is in there at $271 million, with aims of addressing the nursing shortage, which has been exacerbated by COVID burnout and resignations, with retention as an issue along with recruitment. Through research and conversations over these last 8 months, we've identified blockages to the nursing pipeline of faculty shortages, competition for clinical rotation sites, and delay in licensing processing. While the specific funding plan has not yet been determined, the likely program components you can see here are augmenting the Song Brown and other HCI scholarship and loan programs, supporting the Department of Consumer Affairs in expediting nursing board approvals, and creating a nursing pipeline expansion and innovation fund that would really incentivize the field to come up with new practices and programs that remove barriers to expansion and increase the numbers of nursing graduates moving right into the healthcare workforce. Central to this overall initiative is an investment of close to $300 million to train over 25,000 community health workers, promotores. This will create a new certification under HCI to really build a core of promotores in the state. The new CalAIM recognizes the critical importance of these roles, with the proposal to cover the services of community health workers approved by CMMS and now in effect. The certification of programs will be built around core competencies and a curriculum that participants with those certificates will present to employers to get hired for community health worker jobs. Also, and these last few program components I've mentioned really lie under the CHHS umbrella. And just to step back, part of what's so innovative about this initiative is the partnership between the Labor Agency and the Health and Human Service Agency in really bringing our best competencies together to create an initiative that builds a workforce for the healthcare careers of today and of the future. On the human services side, there's close to 200 million in a social work initiative to really address the shortage of social workers and the impact that shortage has on behavioral health and in-home support services. Although planning is in its early stages, this program will expand social work training slots and faculty and explore new training models, including a 4+1 program to get to the MSW level, the possibility of a 2-year community college plus 3-year accelerated program, and apprenticeships for incumbent human service workers. There will also likely to be augmentation of loan repayment and scholarships. Under the labor agency umbrella, there are 3 programs I'll tell you about briefly. One is to replicate the highly successful Emergency Medical Services Corps model in Alameda County, which I had the honor with Labor Secretary Natalie Pelugii to visit in early August. And this program partners with Alameda County Health Systems. Our goal is to replicate this in 10 counties around the state to train 2,000 young people and increase the geographic, racial, and ethnic diversity of EMT roles. This program will target youth with barriers to employment. The EMS Corps in Alameda County really started as a program for youth in juvenile justice facilities and has grown since then and has trained several hundred young people, and many of whom are working for ambulance companies, some of whom have gone on to medical school, to other jobs in healthcare, to firefighters. And so we're excited about taking the success of this model and bringing it to 10 other counties around the state. You may be familiar with the High Road Training Partnerships run by the California Workforce Investment Board. The HRTP model focuses on equity, job quality, worker voice, and industry-led partnerships. The current HRTPs include a few healthcare programs that have worked to train incumbent workers through the SEIU Education and Training Fund, through other partners in the state. And this funding investment will allow us to expand the HRTPs in healthcare and train 10,000 workers for high road jobs in allied health, and really targeting allied health. So those careers such as EKG techs, EEG techs, respiratory techs, radiology techs, and assistant with to fill in that gap and to fill that in on a regional basis, with the CHHS investments really focusing on nursing, social work, and community health workers. We're excited about the potential to build on the success of the current HRTP projects, to expand to new partners, new occupations and regions, and to create new apprenticeship programs in healthcare. The grant portal will be accepting preliminary applications this October, and HIP is really well positioned to develop high road training partnerships in healthcare. I would be excited to explore that with you further. There is also a healthcare workforce advancement fund funded through the Employment Training Panel, which you may know is an employer-led incumbent worker model, which does, given the structure of funding, precludes participation by many healthcare employers, particularly in the nonprofit and public sectors. And so this opens eligibility to healthcare and human service employers to train workers in public, nonprofit, and community-based provider setting. And this performance-based funding could go directly to healthcare employers or indirectly through multiple employer contracts, through an intermediary. We're hopeful that the Employment Training Panel will approve a set of guidelines in October, with funding starting in January 2023. Also in this healthcare initiative is a very exciting investment of Prop 98 dollars, the education dollars, of $130 million in adult education targeted towards English language learners to expand integrated education and training in healthcare occupations. We've put together a planning table now with some private philanthropic support with the adult ed system of the California Department of Education, with the Chancellor's Office, with EDD's Workforce Services branch, to plan for solicitation. We hope to go out in January that would support and nurture partnerships with adult education providers to build programs that accelerate training by combining English language instruction with vocational skills training for in-demand healthcare occupations, and really get rid of that waiting time that slows people down if they have to get to a certain English level before participating in a training program. IET programs, you may be familiar with the IBEST model in Washington State, really accelerate that training by providing the basic English skills with the occupational skills at the same time. We also anticipate the ability to create on-ramps to training for undocumented and other immigrants through this funding. CHHS will also receive funding for psychiatric providers to increase the numbers of behavioral health providers, psychiatrists, psychologists, psychiatric nurse practitioners, and psychiatric RNs through the HCI loan repayment and scholarship programs, as well as a fee and licensure moratorium for new providers. CHHS also anticipates funding through the opioid settlement to support SUD providers and vocational assistance for people with substance abuse disorders, $20 million to increase the reproductive health workforce, so important now, and $12 million to restore local assistance grant funding in the Indian Health Program. So I have described a collection of individual programs. Our vision here, though, is being more than a collection of programs and creating a true initiative. And we are working closely with CHHS, bringing in some of our philanthropic partners to really come up with shared strategies for outreach, for communication, for working collaboratively to connect to the higher ed system, to large statewide employers, and I think quite significantly to remove barriers to employment for justice-involved individual and enable people who have been incarcerated to enter more fluidly into healthcare occupations. We are also working on shared strategies for implementation, aligning solicitations for funding, planning sustainability beyond the duration of this initiative, and in leveraging data, both in terms of labor market demand by occupation and regions, so that we can be very strategic in targeting these funds and preventing saturating some markets while ignoring others, and doing joint evaluation with a shared data system. So given the strength of HIP, I think that there are tremendous opportunities I would encourage you to consider, and again, would welcome follow-up conversations for the High Road Training Partnerships to continue to consider Santa Cruz County as a location for EMS core replication, to expand work I know you're already doing for community health workers and nursing, to consider social work training, and since I know that you have major employers represented, to tap the funds under ETP for incumbent worker training. Again, I want to thank you for having me with you today virtually. I would have liked to have been there in person, and please follow up with questions and ideas. And I thank you for the work that you do and wish you continued success.